This is the case study, Making the Problem Worse, from Darlene Whitlock as a student of California Intercontinental University for Management 616, Organizational Change and Development in Management. For today, we are going to talk about training our employees in the planned change process. For our agenda, we will start with our welcome. Welcome to the meeting. We will talk about our current environment or our need for change, the goals and the vision that we have for the Springfield Hospital, the steps in the change process that we have taken, a list of our team members that are critical to our change, and then some time for some questions and our references that were used for this presentation. First of all, the need for change. In Prossy's ADKAR model of change, the first step that they have is to make each individual aware of the need for change. For the Springfield Hospital, it's important for the employees to know that mistakes in the United States hospitals kills or harms 700,000 patients every year. This also adds to healthcare costs up to $100 billion a year. And worst of all, most of the mistakes that are made are preventable. A patient plus a preventable mistake equals a hospital failure. Our preventable mistakes are easy to fix. They are poor handwriting on our prescriptions, administering the wrong prescription to a patient, confusing medications with similar names, complications caused by medical interactions, not being aware of patient allergies, and then adverse drug events. The adverse drug events is the category for all other type of events that happen that are not specific to those listed above. In the second step of the ADKAR model of change is to ensure each individual has the desire to change. Our overarching goal for Springfield Hospital is that we should change our medication practices to reduce the amount of mistakes that increase our cost and take lives. For me, that would be highly motivating. The vision of the Springfield Hospital is to recognize that a patient plus our change in our medication practices can equal hospital success. Our number one priority is the safety and health of our patients. So, to make this process of changing our medication processes, we have already begun a planned change process. The first thing that we did is we got the team leaders or department managers together and we looked at the best software options that were available. We evaluated and chose this software because of the ease of use, its performance, and the ability to simplify our process in dispensing medications. In the process of evaluation, small department teams and in the smaller hospital wings, they piloted the software, and then they were able to give us feedback to determine if it was the best fit for the hospital. Since that start, all the department managers have been trained to be subject matter experts with the chosen software. They have had the opportunity to use the software and provide feedback. So they will be well trained to help train you. The third and fourth step in the ADKAR model of change is to ensure that each person has the knowledge needed in order to implement the change and that they also have the ability to change. That leads us to steps 3 and 4 in the Springfield Hospital's steps to our planned change. As the team leaders were learning the software, they continue to evaluate and share information in their subject matter expert meetings. They then implemented the use of the software in additional hospital wings, and that brought us a lot of success. So the SMEs are now ready to train you, the department members, on the use of the new software. The training process will begin with a formal meeting that will introduce you to the software features and allow you to ask all your questions. Next, you will get to use the software on the job with one-on-one training. This will allow you to practice and have the ability to ask specific questions. You will also be able to give feedback and work on it until you feel confident using the software. The last step of the ADKAR model of change is to ensure that change is reinforced. To sustain the changes by making sure the people are continuing to implement the changes. In the Springfield steps to make the plan changes, we will continue to have additional trainings until each team member is fully trained and comfortable using the software system. Our managers will continue to monitor and evaluate usage of the software system. So if there's any questions or concerns about the software, be sure to discuss them with your subject matter expert. There are a lot of different team members that are involved in this change process. Everyone from the hospital administrators all the way down to the certified medicine aides are required to understand the software process so that we can have a change in the medication procedures here at Springfield Hospital. We have vendors and software consultants available to answer any questions about any software glitches that may happen. Our department managers, who are our team leaders and our subject matter experts, will also be on hand to answer as many questions as they can. And the doctors, pharmacists, nurses, and those certified medicine aides should be able to be confident in using the software, and we should be able to obtain good results. Are there any questions concerning this presentation, either over the ADKAR model of change, the steps in the planned change process, or any questions in general? Thank you for your time.